want to introduce Dr. Garrett Wynn, again, a fellowship-trained foot and ankle surgeon, joined the Paley Orthopedic and Spine Institute in 2023 after completing a one-year foot and ankle deformity correction fellowship under Dr. Bradley Lamb at the Paley Foot and Ankle Center. Dr. Wynn utilizes the most advanced and innovative techniques to provide patients the ability to return to their sport or activity faster and stronger. Faster and stronger. Dr. Wynn, very pleased to have you with us on ESPN West Palm tonight. Let's start broadly. What exactly is the Achilles tendon? Why is it so crucial for our mobility?
Yeah, great question. So the Achilles tendon is the largest tendon within the body. It's the greatest plantar flexion, which allows the foot to plantar flex. So if you're using the gas pedal, the Achilles tendon fires off and provides that motion into the foot. With that said, it's the Achilles tendon. So it's the crux of the body. If you're unable to use the Achilles tendon, you're unable to walk and weight bear, mobilize and do your activities of daily living, especially in the athletic population. That's primarily your whole career, whether it's tennis, football, lacrosse, baseball, any of those careers, you utilize the Achilles tendon. So it's really the crux of the body. And then typically, that's if you have an injury of the Achilles tendon, it's either a season-ending or a career-ending injury.
Again, Cyrus Woodig here on ESPN West Palm tonight with Dr. Garrett Wynn, fellowship-trained foot and ankle surgeon with the Paley Orthopedic and Spine Institute. And Dr. Wynn, I feel like most times we see an Achilles injury, of course, watching professional sports, and it's a guy, basketball, cutting quickly, or in football, change of direction, that sort of thing. Any sport, planting and trying to accelerate in a different direction. Are those sorts of actions usually the common cause of Achilles tendon injuries?
Yeah, you're exactly right. So the Achilles tendon has a maximum stretch. You need about 10 degrees of dorsiflexion or the ankle moving up. Is it typically movement of your ankle and gait and move and a change of direction within any activity? However, certain times it goes past that limitation. And with these athletes, you're stretching the activity and or movement to the extremes. And so we're going max plantar flexion at a max dorsiflex position. So if your ankle is all the way up and then you try to explode and push off, say jump, move, change of direction, pivot, you're pushing that Achilles tendon to the extreme where the tension overreaches the strength of the actual attachment and you end up getting a rupture. The Achilles tendon itself has inherent instability or crux where it is a hypovascular or low blood supply zone, and typically that's 4 to 6 centimeters proximal or closer away from the heel bone. That's usually where you find those ruptures, especially in these athletes. And there's various techniques to either heal it conservatively or surgical treatment options.
Dr. Wynn, what are the signs and symptoms of an Achilles injury?
Achilles tendon ruptures they're notable. You'll feel an audible pop. You feel a pop. You'll feel weakness, immediate weakness within the foot, the Achilles tendon, which is the back of the heel, going up the back of the leg. It's a sharp shooting pain going up the back leg as well. Typically, you'll feel a dell or a divot where you can feel the Achilles detached from the distal part of the far end of the tendon, and a retraction. If you look at those videos, especially Aaron Rodgers or any of the Kirk Cousins, you can see a retraction or like a rebound effect like a rubber band. And that's the Achilles tendon pulling back up into the leg once it's ruptured or snapped. There are varying degrees, like any tendon rupture, so grade 1, 2, and 3, a partial, halfway, and then a complete. So there are not just one rupture, but it can be a partial, incomplete intratendinous within the tendon or a complete transverse, which you've seen with Aaron Rodgers and Kirk Cousins.
Again, Cyrus Woodig here with Dr. Wynn discussing Achilles tendon injuries. Dr. Wynn is a fellowship-trained foot and ankle surgeon at the Paley Orthopedic and Spine Institute, and he utilizes the most advanced and innovative techniques to provide patients the ability to return to their sport or activity faster and stronger. So, Dr. Wynn, what is the diagnostic process for Achilles tendon injuries?
Sure. Typically, these athletes and patients, they come in relatively fast after the injury. The foot is usually ecchymotic or bruised, and there's a lot of swelling, a lot of pain. Those that have complete rupture, they have an inability to walk or weight bear, put any foot or motion onto the leg, and that's a typical indication of a near complete rupture. I'll examine them in the office, and there's a couple clinical exam findings that we usually test for. Dell sign, you'll look at the back of the leg. There's a palpable dell or divot. You can see and feel it. And then there's something called, we do a Thompson test. So we put the patient face down, belly down, and then have the leg up. And if you squeeze the calf is attached to the heel, which is connected by the Achilles tendon. If you squeeze the calf and the foot moves, that's a negative Thompson. That means the Achilles 100% is intact or partially intact, right? And so, but if you squeeze the calf and there's no foot flexion or movement, that's a positive Thompson test, and that's indicative of a complete Achilles tendon ruptures. This will not tell you if it's a partial, though. Partials are more clinical exam findings where it's tender, I can see, I can feel it's partial dell or a partial divot, but some of it may be attached. In office, you can also do ultrasound to evaluate a complete or partial rupture. And then there's other diagnostic imaging, say MRI. We always take an X-ray to rule out any other injuries, but typically it's a soft tissue injury, so MRI is most likely validated for that.
Dr. Wynn, are there any non-surgical options for an Achilles tear, or is it pretty much, look, if you tear your Achilles, it's going to require surgery if you want to get back to or near 100%?
Yeah, great question. And I typically go through this process with whether it's a patient, a weekend warrior, or a professional athlete. What are your goals? What are your expectations? What is your timeline? How can this injury affect your career or your activities of daily living? Because you can approach this in two different situations, right? So it can be either conservative, whether non-surgical, or a surgical route. Those that are, say, geriatric, or they're not really walking that much, or they don't have, say, high expectations in walking and mobilizing, just community ambulator, walking around the house. I just want to go to Publix. I just want to walk around, and I have time. I have no work restrictions or anything like that. Conservative treatments can be an option. It's usually 6 to 8 weeks in a plantar flex cast, non-weight bearing. Allow the tendon to heal. Tendons typically heal around 6 weeks, and plus some sort of rehabilitation process. With that said, with the conservative versus the surgical treatment options, there's a slightly higher re-rupture risk. But with any surgery, there carries an inherent comorbidities and risks and complications, so it's not all without risks. With those patients that are more of a weekend warrior, or those that are a little bit more active, or especially the professional realm, we want to get those patients back to their activities or sport better, faster, and stronger. With the surgical route, we can get them back in weight bearing almost immediately, depending on their expectations, either right out from surgery or 2 weeks out from surgery. When the sutures are removed, they can start walking in weight bearing. So the timeline is vastly different, and literature has shown that the re-rupture rate of a surgical treatment repair versus a conservative treatment repair, especially within the last 5 years or so, have shown a decreased re-rupture rate. And for me, that makes the biggest difference.
Again, Cyrus Wittig here on ESPN West Palm tonight, speaking with Dr. Garrett Wynn, a fellowship-trained foot and ankle surgeon at the Paley Orthopedic and Spine Institute. Again, talking about Achilles and of course, Achilles injuries. Dr. Wynn, what does the surgical process look like for, again, the Achilles surgery? Kind of walk us through an overview of that.
We're in an amazing time period where innovation technology has met the surgical realm. And I think the difference from surgery 5 years ago to the current 5 years has really innovated and really accelerated the recovery process in terms of the surgical treatment. Say prior to the last 5 years or so, more of the repairs have been done open, so it leads to a longer recovery, higher complication rate. That area of the Achilles tendon typically has a lower vascular zone or hypovascular zone, so you typically have some maybe wound healing issues depending on how long or big that incision is. Depending on the severity, they can be really long, say 6-8 centimeters, 4 to 6-8 centimeters, just to repair the Achilles tendon end to end. With these new minimally invasive techniques, technology has really accelerated this process, provided tools and anchors, and so that we can do the repair in 2 centimeters or less in a percutaneous fashion. So therefore, you're minimizing the complication rate, minimize the wound healing. Not only that, say an end-to-end repair, say done traditionally, you rely on the tendon to heal. You're still waiting about 6 to 8 weeks for it to fully heal. With these new minimally invasive techniques, we're repairing it end-to-end. However, we're augmenting it and we're anchoring it into the bone of the heel bone. That gives us strength and stability at time zero, right after the injury, right after the surgery repair. And therefore, we're able to get our patients walking weight bearing almost immediately. And I think that in itself is a game changer, a paradigm shift for our Achilles repairs.
Dr. Wynn, I still want to get into Aaron Rodgers and his recovery from his Achilles tear. But for those of us who aren't in the 0.001% of athletes, what does the rehab process look like from an Achilles surgery?
That's a great question. And to get a broader picture, I always tell my patients surgery is half the battle. Mm-hmm. The other half of the battle is your rehabilitation process as well as your kind of nutrition status and protoplasm, which is what you eat and how you approach your life, whether you're a smoker or other comorbidities. So this is a great question. So with the rehabilitation process, with the minimally invasive newer techniques, you're able to kind of walk in weight bear in about 2 weeks once the sutures come out, and then you're protected weight bearing for about 4 weeks, and then rehab starting week 3 after the surgery. And so you're relatively getting back up and moving pretty fast with these newer techniques because you get a stronger repair at, again, time zero. Mm-hmm. So you're looking like Aaron Rodgers back on the playing field in 2-3 weeks. And I believe Kirk Cousins may have had an open versus Aaron Rodgers was a minimally invasive, and Kirk Cousins isn't quite back yet at the same time. And you can kind of see that those black and white pictures in terms of repair. And not saying that every repair can be repaired in minimally invasive. Some do require an open, but those are the differences between the two surgical repairs. Timeline between all those, typically in the past, you're looking at 6 to 8 months before you're returning to full activity, back to your sport activity or walking weight bearing or doing your weekend warrior type competitions. With these newer techniques, you're cutting that time in about 2-3 more months, 2 or 3 months less. So I think that says a lot with repairs, and especially if that's your lifelong kind of career and that's how you make your living. I think that makes a big difference.
Again, Cyrus Wittig here with Dr. Wynn discussing Achilles tendon injuries. Dr. Wynn is a fellowship-trained foot and ankle surgeon at the Paley Orthopedic and Spine Institute, and he utilizes the most advanced and innovative techniques to provide patients the ability to return to their sport or activity faster and stronger. So, Dr. Wynn, preview this at the top of the segment and want to go to you, the expert, for the answers. Aaron Rodgers, week 1, play 4, tears his Achilles, one of the worst injuries you can suffer in sports, not to mention the NFL. And the speculation is he's going to be out for at least the season, and it could be a 12-month injury. Couple weeks later, he's walking with no boot. You would never know that he is hurt. A couple weeks after that, he's back on the playing surface, warming up before a game in street clothes. But still, doctors saying that was miraculous in itself. A few weeks after that, he's back on the practice field, playing a little bit with the scout team. Although today he announced that he would not be back the rest of the year. Again, it seems like a medical miracle that he has recovered this fast, and he could play maybe in, 2 months or so. Dr. Wynn, I guess the question is, how is it possible that Aaron Rodgers has made this sort of recovery after an Achilles tear?
I do believe his timeline, especially with the techniques and innovations that we currently have, is very plausible. Like I said, to do the minimally invasive anchor into the bone, you get strength, stability at time zero. After the surgery, there's no need for the tendon to reattach and heal. You attach the tendon down to the bone and reattach the tendon together. So both those secondary and primary augmentations and healing capacities allow the patients and athletes to get better, faster, and stronger. Additionally, Aaron Rodgers and those that have that caliber of secondary support meaning physical therapists, rehab, plus the regenerative medicine capabilities, whether it be PRP stem cells, BMAC, which is bone marrow aspirate concentrate, any of those natural stem cells and healing capacities, along with his nutritional and diet, can really accelerate these Achilles tendon ruptures to pretty minimal, to a couple weeks and back on the field. And so Aaron Rodgers is not, say, an abnormality or say he didn't really tear the Achilles tendon. The new technologies and the secondary support makes it very possible and very feasible. And I think in the new realm, you'll see more of that with the athletes going forward.
Dr. Wynn, super interesting stuff. And, of course, it's no fun. We're going to see these sorts of injuries continue in the future. But the good news is, hopefully, like Aaron Rodgers, more guys than not can have the recovery and rehab that he's going through and get back on the field ASAP. Dr. Wynn, I will let you go. But, again, awesome stuff. Super interesting, super insightful. Pleasure to have you here with us on ESPN West Palm tonight, and I look forward to our next conversation in 2024.
Thank you for having me.
Once more, that was Dr. Garrett Wynn, fellowship-trained foot and ankle surgeon at the Paley Orthopedic and Spine Institute. And to learn more about Dr. Wynn, visit PaleyInstitute.org. That is PALEY Institute.org. Or call the Paley Orthopedic and Spine Institute at 561-844-5255. Again, Paley Orthopedic and Spine Institute, 561-844-5255. We'll take a break here on ESPN West Palm tonight. And when we come back, we will talk to the man leading the charge for fair pay for high school coaches in the state of Florida. That's next on ESPN 106.3.